Hi friends, welcome to my channel. Today we are going to discuss about the hypertonic fluids. Hyper means more, that is the concentration or the solutes present in these hypertonic fluids is more than that of plasma. As concentration is more, the water content should be less. So the water content is less than that of plasma. So they are called as concentrated fluids or thick fluids. As they contain less amount of water, the water moves from the intracellular fluid into the interstitial fluid and then into the plasma. Because relatively there is more water inside the cells. As the fluid is moving out of the cell, the volume of the cell is decreased. And so the size of the cell is decreased. That means shrinking of the cell occurs. Examples for the hypertonic fluids are 3% and 5% normal saline, dextrose normal saline, that is DNS, half DNS, 10%, 25% and 50% dextrose, mannitol, 20% albumin. So now we will see what occurs if a hypertonic fluid is infused into the blood vessel. As it is a hypertonic solution, that means concentration is more and water content is less. Once it enters the plasma, the fluid from the cells is shifted into the plasma. As the fluid from the cells is shifted, the size of the cell is decreased and volume of the cell is decreased. That is, shrinking of the cells occurs. So why do we want the cell size to be decreased, or why do we want the cells to be shrunken? In cerebral edema or raised intracranial pressure, the cells are already swollen. So infusion of these fluids causes the fluid to shift from the cell into the interstitial fluid and then into the plasma, which results in decrease in the volume of the cell, and thus the size of the cell decreases and the cerebral edema is decreased. So they are used in cerebral edema or raised intracranial pressure, heat exhaustion, heat stroke, hypovolemia, peritoneal dialysis and peritonitis. Coming to the precautions that to be taken while using these fluids. These fluids should be infused slowly because rapid infusion can cause cellular dehydration and fluid overload, that means hypervolemia. As the fluid is shifted from the cells into the plasma, the cellular fluid is decreased. That means cellular dehydration can occur. As all the fluid enters the plasma, plasma volume is increased. That means fluid overload occurs. And the dextrose containing fluids can cause hyperglycemia. So